In this video, I'm going to be focusing our attention on clinical depression or major depressive disorder and how you can treat and prevent it. This video is divided into 3 sections. The first section is going to focus on the problems associated with depression, the symptoms we might call them. I'm then going to look at the underlying causes. What are the factors that can often result in an individual experiencing depression? And then I'm going to be looking at treatment and prevention options. Hi, I'm Mork-chadwick. I'm a psychologist and I'm absolutely passionate about helping people move away from a lifetime of chronic medication and moving towards taking back control of their own health and well-being. So let's kick off by looking at the problems associated with clinical depression. As you may be aware, the problems involve our feeling and emotional functioning. We are also impacted at a cognitive or thinking level of functioning, and our physical functioning as well is impacted negatively. So let's start with the problems associated with our physical functioning. There's almost always a change that is experienced in one's sleep patterns as well as in one's appetite. What many people find when they go into a depressive episode, as it's termed, is that their sleep patterns become disrupted. They either find that it is hard to fall asleep, in other words, insomnia creeps in, or if they fall asleep quite quickly, they'll often find they wake up during the night, around about 12, 1, 2 o'clock in the morning. They may fall asleep after an hour or so, but they're likely to wake up again. Whatever the situation, most people who go into a depressive episode find that they don't get a full night of unbroken sleep. Similarly, with appetite, most people who go into a depression find that their appetite deteriorates, it diminishes. They lose their sense of hunger. You may find, though, that if you've gone into a depressive episode and your appetite has left you, that actually you're eating a lot of food. It's probably because you've resorted to emotional eating, comfort eating, and that is often the case. Fatigue is another very common problem. Many people will complain of having no energy to do anything. And the deeper you drop into a depressive episode, the harder you're going to find it to get out of bed in the morning and to engage with daily living. The last physical problem I want to talk about is what we call psychomotor retardation and or psychomotor agitation. So the word psychomotor involves psyche, the mind, and motor, which has to do with the body and movement. So psychomotor retardation simply suggests that you may find that your brain and your body become dumbed down, as it were. There's not much going on up here, and your body is feeling like it can't do much either. Some people experience psychomotor agitation, which is the exact opposite. Your mind is never still. Your mind is restless, and physically your body is restless as well. And if you're particularly unlucky, you may in fact experience both of these. Now, if we move on to how our cognitive or thinking functioning is affected, one of the most important symptoms or problems is this. Indecision. You're very likely to find it harder and harder to make even the most basic and simple decisions. For example, should I have oats for breakfast or should I have muesli? And then you find yourself having to ask your partner or your spouse or whoever might be living with you. It's not life-changing decisions that are hard. Those are always hard. It's the simple daily decisions which become really difficult. Another very common symptom is your short-term memory becomes affected. You will find it harder and harder to hold information for any length of time, anything beyond a few seconds even. You may find you put your keys down somewhere and then you've forgotten where you've put them and you spend the rest of the day looking for them. You may be in an interaction with a friend and directly after that conversation you've forgotten half of what was spoken about. Another symptom this is what we might term attentional ability. And your attentional ability is really just about being able to focus your attention for an extended period of time. But with depression, that also deteriorates. And you find your mind wandering a lot of the time. So you're just not able to stay focused. Whether it's focused on the TV, focused on what you're writing on your laptop, focused on a conversation with someone, you'll find your mind wanders. Negative thinking is another cognitive problem that people will experience. And really all it means is that you'll find it almost impossible to think positive thoughts. It's impossible to see the light at the end of the tunnel, as it were. And what is especially hard about this problem is that you'll be able to very quickly see that your friends and family possibly don't like to spend time with you because you're so negative, because we become so cynical, it seems, to those outside. The final problem is suicidal ideation. Suicidal ideation is what we're saying here is that you have suicidal thoughts. Now this is different from being actively suicidal, which means you've started to plan how you're going to kill yourself, when you'll kill yourself, and where you'll kill yourself. Suicidal ideation are thoughts. You've started to wonder what it's like to be dead, what it might be like to end your life. This is not as serious or as significant as being actively suicidal, but if you start having suicidal thoughts, which are very common, you do need to speak with someone, whether it is a trusted friend or a trusted family member, or perhaps your doctor or a psychologist. It does need to be spoken about. Now, if we move across to how our emotional functioning is negatively impacted, one of the first and most common emotions that is associated with a depressive episode is this one. A sense or a feeling of hopelessness. And it's easy to understand this, especially if you've had depression in the past. If you try the medication, you try the psychotherapy, perhaps you've even made some lifestyle changes, and yet nothing seems to be working, hopelessness will creep in. And often, with hopelessness comes that suicidal ideation, if not active suicidality. So you do need to monitor yourself and your levels of hopelessness. Two other very commonly experienced emotions are the following. Guilt and shame. They're both fairly easy to understand, I think. Many of us who've experienced depression or who are in a depressive episode now will experience quite high levels of guilt. We feel guilty because we start to feel we're a burden on those we love. We start to feel that we cause our friends and family to worry about us. And so many of us feel a lot of intense guilt. Shame is another awful emotion to experience. And often when we're in a depressive episode, shame is highlighted. But it's easy to understand, I think. There are such high levels of social stigma attached to having mental health problems, like depression, that we often feel ashamed that we've allowed ourselves to go into a depressive episode. So shame is very easy to understand, just because of the social stigma that exists. But family and friends, unfortunately, often have the habit of saying things which they believe or hope will motivate us to get out of our depression. But the things they say often make us feel even more ashamed. So friends and family might say things like, "But look, you have nothing to be depressed about. You have a wonderful job, a loving spouse, a nice house. Come on, see if you can pull yourself out of this." And of course, it's not that easy. It's in fact relatively impossible to think oneself out of a depression. But we get left feeling like we have failed. So shame is a very common emotion. We also find the following. Our self-esteem, our self-confidence, our sense of self-worth deteriorates. It's a very common symptom. And it's partly because we feel like we are failing and letting down family and friends. A depressed mood, for many of us who have dropped into a depression, is very common. And this just means we feel tearful, sad, down, blue, however you want to phrase it, just about every day of the week, most of the day. But it's not everyone who experiences a depressed mood. Some will experience a loss of interest and pleasure in just about everything. So those activities that you used to love engaging with, those hobbies, often you'll find yourself thinking, "I'm just not interested," or "Sure, I'm not motivated to do this anymore," or I just don't have the energy. Well, that's this problem. This is one of the key symptoms for many people. There are some who experience very few of these symptoms, but who experience this. Increasing levels of irritability. In other words, things that used to annoy them a little now really annoy them a lot and very quickly. People who used to have this much patience now find that their fuse is this short. When others do silly things that may have been a little irritating, now often you'll find that you lose your cool. And there may be some sort of uncontrolled outburst that follows regularly. It's a very common problem associated with depression.